They might be filtering in a little bit as we continue to speak. But I want to welcome you to the Business of Health Career Networks program panel. It's the Digital Health Technology and Health Innovation panel tonight. Thanks for joining us. For this evening panel, which is part of the UNC Center for the Business of Health's Career Networks program. Career Networks is a constellation of resources meant to educate and create community around the continuously evolving healthcare ecosystem. You can explore the CBOH Career Networks platform via the URL that I'll paste in the chat box in just a second. For tonight's panel, we ask that you turn your video on and mute your microphone while not asking questions. Again, if you're in a clinical situation or somewhere where you choose not to have your camera on, we're okay with that. And feel free to ask questions in the chat. When you do have a question, you can raise your digital hand and the panelists will answer your questions throughout the discussion. We'll also pause every couple of moderated questions for audience questions as well. Tonight's conversation will be on experiences and perspectives from multiple folks in the digital health, technology, and health innovation space. I'm Susanne Killian. I'm the Associate Director for Student Engagement with the Center for the Business of Health. And I have Erin Leach, our Program Manager behind the scenes tonight, who's letting you all in and making sure that we're spotlighted and everything's running well. Our panelists tonight are Samantha Register, Mike Rawaan, Rajen Patel, and Rachel Metis. And at this point in time, I am going to turn it over to our panelists and I'm going to let them introduce themselves. I'm going to go ahead and start as I see them. So we'll do Samantha, Rajen, Mike, and Rachel. So Samantha, go ahead.
All right, good stuff. So name's Samantha Register. I'm a Kenan-Flagler alum, class of 2016. I am working at a company called OM1. I'm a senior director of real world evidence and artificial intelligence, which is a big old mouthful, but I'm focused on sales. So it's a very niche type of healthcare research. I did my MBA internship at GSK and then did a pretty long tour at IQVIA as well, for anyone who's familiar with the clinical research space. All right, over to you, Raj.
All right, appreciate it. Hello, my name is Rajen Patel. I am the CTO of Metis Org Solutions, which is a company that I also founded. Before that, I actually worked at McKesson US Oncology on the radiation oncology space. I Kenan-Flagler alumni in 2020. I have a master's in physics, so I work in the oncology arena, but I'm also working in the business side with operations and strategy.
Hey, Mike.
Hi, everyone. Mike Rawaan. I am the founder and principal consultant at Covalence Healthcare Consulting. We're a small consultancy out of the Washington, D.C. area, and we focus primarily on healthcare and work with a lot of healthcare tech companies. A lot of them are sort of in the startup and believe, at least they pitch that they're in the cutting edge. And so we have the luxury of kind of, getting acclimated and playing with the cool toys as they are being sort of introduced into the healthcare ecosystem. By training, I'm a technology guy. Also am a Kenan-Flagler alumni, class of 2012 at the evening MBA program. And I've shifted my focus in product development, product management, program management strategy. But as part of that, I've kind of stayed in touch with technology and incorporating technology into the healthcare space and helping technology companies really kind of find their product market fit. So excited to be here.
Thanks. And Rachel, round us out.
Yeah, thank you. So Rachel Metis, I am a product manager of AI and automation for Align Technology. More well known as the makers of Invisalign and their digital scanners, iTero. I have a unique background. I actually started off in IT risk management and audit. I focused a lot on CROs and pharmaceutical companies while I was in that space, moved over to the audit practice at Align, and then shifted into product management. I'm also a Kenan-Flagler alum, 2022. And a undergrad alum as well. So go Heels.
Terrific. Thank you. Great introductions. And tonight, so we're going to start with what I think is a very important question. As we all know, that digital health technology and health innovation is a very diverse field. So I think one of the things that would really be interesting is to understand what steps did you take to land in your current role and career, and can you please define your current role? Because again, too, there's so many roles in this industry that I think everybody kind of wants to know, what is it called and what do you do? So again, you can start popcorn style.
Ooh. So the honest answer, so this is not the one that you use in any of your star interviews when you're doing like your 30-second intro, and you just kind of tripped into it, right? So when I was in B school, I used that opportunity to figure out like, who doesn't hate their job? I was like, all right, and who's working for a company where they actually like their coworkers? All right, that's where I want to start. And ended up finding a company called Quintiles, and just everyone I talked to was happy. And I was like, one, that's suspicious, but two, like, all right, let's give it a shot. So just kept networking. The Keenan Flagler Alumni Network is incredible. People were just so kind. They met with me, they talked with me, and they're like, well, what are you looking to do? What are you interested in? And it just kind of helped me figure out how to get my foot in the door. And then I grew from there. So I think with a lot of the big companies, at least, I'm now at a more niche company, but it was really beneficial to start somewhere big where I could get kind of sink my teeth in, figure out what I wanted to do. And I ended up falling in love with sales. So, but to each their own. I know folks kind of move around, but that was my approach.
In my case, I actually was a clinician and still am. I started out my career as a physicist, but in oncology. So I worked for 20 years in Greenville, North Carolina. I helped build a cancer center when I started Keenan Flagler, and the goal to go was to get more leadership and also to expand my role as it was, because I was in charge of a lot of people. When I started, I was like, hey, I'm just going to move up the ranks in the healthcare space. But after going to Keenan Flagler, I realized that there's more to the story than just being a clinician, and the ability to pivot and see things from a different perspective really helped out. So after that, I ended up working at a Siemens Healthineers, which it is now, but it was Varian. And I realized consulting and doing the same stuff that I'm doing, but in a business and operations manner, is kind of how things landed. And that's how I ended up at McKesson. And then I started my own company. So just because you start somewhere doesn't necessarily is where you end up. So that's the beauty of B school, and also the network of people that you encounter, because there's new ideas, there's new niches that you've never heard of, and then there's people that give you perspective. So I guess you could call it the hero's journey. You don't choose your path, the path chooses itself for you, you know?
Awesome.
Yeah, I can share as well. So for me, I started at Red Hat. I was working in their policy and compliance division, and then I shifted over into EY under risk management, and I was doing both financial services and IT. I found IT to be a lot more interesting because it was a lot more creative. It's a lot less ticking and tying of numbers. You can think about how you want to help improve processes. So I liked that aspect of it. It's also constantly changing, so it's not doing the same thing every single day, every single year. So I liked that shift. So I knew for my next role, I wanted it to be solely IT audit, and that's why I took the position with Align. I also had a lot of experience in the healthcare industry, so I was really familiar with all of the regulations and considerations when you work in that space. I did my executive MBA while still working at Align, and I knew I wanted to move more into a strategic role. During this time, I was really diving into robotic process automation for internal auditors. And as part of that sort of side project that I was working on, it became very apparent that a lot of people across the organization could really benefit from this type of technology, and it shouldn't be under internal audit, which is, you know, an independent body, and there was a need to sort of pull that out and put it in its own space for internal employee use. And essentially a team was created. I was brought over to that team, and I had the opportunity to really dive into that and get experience as a product manager. And then that evolved into include AI as well. So it's been a interesting, fun journey. I'd really just say be open to opportunities, network with other stakeholders in whatever organization you end up in, because you don't know what someone's day-to-day role might look like, and you might have an interest in it. And if they know that you're a hard worker and or someone that they might want to have on their team or that they can trust, you might see more doors open for you.
I think everyone's made some of the key points that I wanted to make, which is around networking and also being versatile and kind of being open to those opportunities as they pop up. I've been pretty fortunate because if I reflect back on my career, that's going back 25 years, it's the evolution of, almost the inception of the internet and the evolution of what I would call digitization. And so I've been able to experience all of that. And I got into technology because it was an emerging field. Honestly, when I was out of high school, I enlisted in the Marine Corps, and my job was a network operator, which I was basically the tech support person. And when I left the Corps, that was a natural path for me. So I went to school and I got an associate's degree in communication and technology, and kind of got in the architecture and infrastructure side of things. And at the time, you think this is mid to late 90s, IT kind of became really, really boring, even though, everybody was going through the whole .com thing and that was kind of popping up. But the work itself just really wasn't that much fun unless you were coding. And I was never going to be a coder. That was, I think, a decision I made from the beginning. It just wasn't for me. And so I shifted over to product development and more on the business side. And one of the reasons I went to get my MBA is I wanted to better understand the business world and how I can connect that back to technology. And now I would say over the past 15 years or so, I really have been able to experience that, which is from the business point of view. Now we have developed a dependency on technology. So as much as I try to get away from technology, it keeps pulling me back in, because as much as I like to focus on a business solution, always understand that there's a technology and a digital component that's going to come with that solution. And so no matter where you are in your career and where your focus is, understand that it ties to technology somehow. And that could be the entrance path for you, right? It could be you're in sales right now, you're selling something that is a technology product, or it's some type of service that runs on a technology platform. There's always that technology component that is going to be there for you to just kind of lean into and say, okay, this is where I want to start. I know something about this. I can easily get myself up to speed on this and get into the technology space. So I'll leave it there. I can go and ramble on about this in terms of what are some of the other paths that I've seen in my career, and how we, I do a lot of mentoring for some of the folks in my firm, as well as some of the folks who are in the program, and happy to talk about that. But I'll turn it back over to Susanne for now.
Terrific. And thank you for the great explanations of your myriad of roles. And you did such a great job of kind of telling the crowd how you kind of grew into that role, or what the pathway was. What I think is really awesome is, like, your pathway can be from technology, into the healthcare technology, or it can be from healthcare into healthcare technology. And this kind of feeds into my next question, which I heard already about kind of skills, abilities. Samantha, I loved what you said. Like, I want to go somewhere and look at a place where people enjoy going to work, that's the basis. So what skills, abilities, and experiences do you use regularly and most often in your careers right now? And those might be some that you hadn't thought of before you had these careers.
Yeah. I did want to piggyback on one thing Mike said, which is one of the best pieces of advice I ever got was, wherever you're working, you should either be learning or earning, preferably both. But if you're not getting at least one of those, it's time to go. In terms of skills, I would say the courses I wish I had taken more of in B school, honestly, were all the soft skills stuff, particularly if you were going to be working So I've worked in large matrixed organization, 90,000 plus global, and I'm working in a, sub 300 tiny small company. Doesn't matter where you are. You need to be able to communicate. You need to be able to, don't be weird. Just like, don't be weird. Don't be a jerk, and don't be weird. Like, just be kind, give people the benefit of the doubt, be someone who people like working with, like pull your weight. And you know that instinctively, right? You look at any group project you've ever been in as a kid and you're like, man, don't be the person who like, everyone's like, oh no, I got Samantha. Like, oh, it's gonna be a pain, right? So I think soft skills more than anything else are what help you move up the ladder quickly. Because there's a lot of hard workers and a lot of smart people. Smart, ooh, that's a word to mess up on a live panel. So that would be my advice, but I'm curious what the other panelists have to say.
I'm going to jump in.
Relationship
I'm going to
building.
go on the other spectrum. I'm sorry,
Mhm.
Raj.
No, go for it.
The other end of the spectrum, and I don't disagree with what Samantha said. I think soft skills are absolutely important. I believe you have to have a balance of sort of the hard skills as well. And when I think about courses, whether it was through undergrad or through the MBA program here, your statistics and economics, like know those by heart. And I know those for a lot of people, those are just like the most boring classes. God love Alan Neby. He's a great professor, but his class was just dull. But at the end of the day, a lot of what I learned in those classes are things I still use every day. A lot of the model building. And I say that because if you think about where healthcare and technology is going to, it's a lot of data sciences, right? And all of those use some of the concepts that are taught in those classes. And economics, no matter what you do, know economics, understand your economics, because that is one thing that applies across the board. In fact, one of the greatest piece of advice that I've gotten from a professor, it was a history professor during my undergrad, who said, the most important issue, whether we're talking about an election, whether we're talking about any type of discussion in a boardroom, whether it's amongst friends or families, is always economics. Economics trumps everything because it impacts each individual. And so those are the things that I would say focus on a little bit more as you start to get into healthcare and technology. Those become very, very important. I talked about the data sciences and understanding statistics because those are foundational to data sciences. And economics is because at the end of the day, you have to understand how the money flows and how the business operates. And understanding economics is going to be foundational to understanding the business models. And that's going to help you be a better technology professional when you understand what the business is trying to do and ultimately how your company makes money. That's going to help you design better solutions or support your organizations better from a technology standpoint.
And Rajen?
Before I go, Rachel, do you want to go first?
Yeah,
Or
I actually had a
yeah,
few
go for
things
it.
to add on to what Mike said. So I completely agree with the economic standpoint. So from a product management perspective, you want to think about how can you present this to leadership to get the resources and budget and funding that you need. And a lot of times it's not just, oh, this is going to save people manual hours. They don't care about that because the work will get done. What they want to see is how are you going to save tangible money? Like what is going to bring in money by doing this exact process? So knowing how to calculate ROI, knowing how to find processes that could be improved upon from a technology implementation is really, really crucial. I also want to touch on something Samantha said. So people, it's a huge, huge part of everyday life in the working world. So managing in the middle, knowing how to talk to your senior leadership, knowing how to talk to staff. Also, for me, knowing how to talk to engineers, have that technical understanding and know-how, but also translate it to people who are not technical at all. So knowing how to break things down and make it simplified, but also be able to get the respect of your engineering team. So that's something that I do every single day. And I think that Keenan Flagler actually had some really good classes on managing in the middle and, being able to drive effectiveness without necessarily being an executive and having that kind of power.
Influence without authority. Everyone's favorite.
Mhm.
Everyone's favorite word.
And Rajen, do you have anything to round this out?
I'm going to basically go with the advice that I got, and it pretty much piggybacks. It's two things: be different, be bold. And what I mean by that is all of us have whatever our niche experience is, right? So like in my case, my general experience is physics, and I did some other undergrad degrees, but being a social person in a field that is traditionally very antisocial made me different. And the part what I'm saying about being bold is uh, just like Mike said, you got to step out of your lane. You got to make yourself available and be a little vulnerable for those positions and for those experiences that could help you grow and also be seen. Rounding with everybody, whether it's leading in the middle, storytelling and influencing, or if it's anything that involves the soft skills. And I think all of us did the 360 assessment. You learn more about yourself. And it's very important when you learn more about yourself, then you know how you can really present yourself to be bold and be different. So I think all of this is great.
Terrific and wonderful advice. I am going to pause here to see if we have any questions from our audience. Again, too, if you raise your digital hand, you'll kind of slide into my view and you can unmute and ask your question. I was going to say, it's technology, folks. You've got to have something that you're interested in. Oh, there we go. Suni, go ahead.
Hey everyone, my name is Suni and thanks for having me here. So I'm currently a sophomore at UNC. My major, like my intended major is health policy and management and information science. So the reason why I want to choose this double major is that I wanted to have a knowledge, like a fundamental knowledge about healthcare field, but also get the skills of how to cope with technology. And then my career goal, like very specifically, is heading to the healthcare product manager. So same with Rachel. And then my confused about like the recruiting is that I found on the current market, there's not a lot of associate program manager position open in the market right now. So I was a bit confused, like how can I, to show to my recruiters and companies that I am fully capable of taking those responsibility as a new graduates after finishing my like college and be a new like people into the market. So this is my like question. Thank you.
Can I take that? Because I do org solutions and staffing.
Do it.
Okay, cool.
Okay,
Thank you.
this is actually my niche. So okay, so with you graduating, the first thing I'm going to recommend is just like every panelist has said, stand out. Because if everybody's getting the same education as you, now it's great that you're doing multiple education, so you're getting a different perspective and also more skill sets. Networking is going to be key for you. Okay. So and this is going to be crazy when I'm about to say it. Right now with McKesson, I have 531 cancer clinics that we are managing for staffing across the US. And the most common thing that I get from new graduates is, here's my resume. Here's the things I did in school. And so just imagine if everybody presents the same exact way, who do I pick? So I need to know more about my candidates and I talk to them. And what you quickly find out is there's a lot of information that is missing that a sheet of paper can't tell you. So it becomes very important that you stand out of your peers or the other competitive people in the market. Next thing I'm going to say, a recruiter is an independent individual that is looking at you and helping you. And it's kind of a relationship where you build as you talk to the individual over time. So it becomes important to be present at networking events, to go out there in the field and network with those companies and maybe former graduates like us to get yourself known. And that way we can mentor you and also have you maybe be a person in our organization that could be a talent acquisition. So my recommendation is to just get out there and not just do what everyone else does, which is submit a sheet of paper and go to a recruiter, because we gotta see you, hear you, and actually be confident that, hey, this is the path that you're choosing. Because when you recruit, it's a relationship that we're also helping you find the right fit too.
And I have something to add too. So I know you said you're interested in product management, and I know can be a hard field to jump into, especially without having any prior experience. So what I would recommend is find something that's close to it. Business analyst is a good one. There are often more entry-level positions in that field. And if you're interested in healthcare, I would just try to stick within that industry. But really just building up your resume to have some kind of internship experience. Even if it's not your dream job, you can always pivot it into that in the future, but just start working, start learning. People really appreciate it when, you're not coming in 100% green into your first entry level job. You have some exposure to the industry, the corporate world. So I would just look for things that you can kind of mold into what you actually want to do in the future, and you'll get there.
I agree with Rachel, 1,000%. I think her advice about look for other roles that are going to kind of lead you to where you want to go, because she's absolutely right. Product management is sort of middle career type, right? They're going to look for 10 years of experience in a lot of organizations. You could be a product owner, right? Which is typically sort of a level below the product manager. But also most organizations have an analyst type role that is typically entry level. And that's where I would start, right? So it's not so much, and just kind of piggybacking about what Rajen also said, is understand that you have to stand out. You have to kind of pick a path to where you want to go, right? And there's multiple paths to do it. So don't necessarily just focus on, hey, this is the job I want and I'm going to get it right out of college, because that just may not be a possibility. And you're going to be competing with so many different other individuals who are basically in the same boat that you are, and likely have same level of experience and expertise that you do. So I think just defining the path for yourself and focusing on the shorter milestones, right? Like, hey, step one, maybe I just want to get in with an immersion program with McKinsey on their healthcare, right? That's going to give me a significant amount of experience. Then now I can kind of move into that product owner role, and then ultimately to the product manager.
Yeah, I'd agree. Internships
That's great.
There's almost nothing else you can do in college that's more than an internship, I would say, just because it shows you can operate in the work world, right? Like you're going to learn how to handle your inbox, how to format that Excel, all that really basic stuff. If you're looking for examples, one of my favorite websites is called Ask a Manager, and they have some phenomenal resources as examples of like cover letters and resumes of ways you can stand out, even when, on paper, you have the same credentials, same coursework, same GPA, same volunteering, all of that. It's basically, how do you communicate? How do you tell a story about yourself, about what you're like to work with, right? Are you a hard worker? Are you great? Are you a good storyteller? Are you a whiz with numbers? Are you the go-to person, on your dorm floor for anything that has to be fixed on a computer, right? Things like that kind of make you a more well-rounded, and frankly, just more interesting candidate, because Rajen's probably run into this a million times. You have a stack and you're like, oh my God, what will help me remember you? And sometimes that's even just your like other section of like, oh, like I run marathons. Like, oh, wow, this person has the hustle to train and run marathons. And it doesn't have to be marathons. I've never run a marathon.
Well, they're crazy.
But you can, whatever your thing is, and it's okay if you don't know what your thing is yet. You can just try stuff, fail at a bunch of stuff, and just keep learning. Like, all you got to do is just keep learning.
Thank you. Thank you for all your guys' season suggestions.
Absolutely. And these were absolutely wonderful suggestions. And remember, I did pop in, shameless plug, our career networks platform here. And again, with networking, we have a lot of warm contacts on there, and it's great to start. I can't say anything more about networking with live people and being able to create those relationships, because again, too, that's kind of where you're going to get those key pieces of information, and also some opportunities that might not be posted can give you some like kind of a leg up. All right, we've got another question. Liz, go ahead.
Sure. Thank you so much. And thanks everyone for all your advice so far. I appreciate it. My background, I'm currently a PhD candidate actually in health informatics. So I come from more of the digital health and technology space. And my work is related to health technology tools, and actually work with medical physicists and radiation oncology, which is the cool connect over there. So that's really awesome. Don't see many of that in like the business realm of things. My question was, I wanted to get your thoughts on getting an MBA and what kind of difference that might make specifically in the digital health and technology space. I guess in terms of like whether or not that should be a consideration for someone with a background like me, or with slash, I guess, in terms of if there's any cons as well, aside from like cost and time. And I guess, yeah, thoughts on getting an MBA for that digital health and technology area, aside from having it be a situation of it standing out on your resume. Thanks.
Raj, this is all you.
Well, she said medical physicist, and I got real red because very few people know what a medical physicist is, so that made me excited. Okay. Coming from a technical science background, let's start there. Okay, so getting that MBA, my motivation was a little different, and I'll tell you where my space came from. So I was in charge of 6 cancer practices, and what I found is clinical decisions were being made for my patients and for my charges without right information, or just being made because we weren't vocal or in the room. And breaking that mold was very good for me in the MBA. And so what it did was, when I got my MBA, I actually was invited to a board of directors meeting, and there's executives and everything. So what was interesting is I found that when I was there, my feedback, one, helped save the organization money, but 2, what it did is it made me aware of the broad scope of what I was missing, because I look at, hey, this is my expertise. I'm just doing clinical work. So the MBA opened my eyes. So that's the benefit. Okay. Now, here's the only problem with that, Liz, is that when you transform, you also have to be able to handle your transformation into this new universe and completely immerse in it. So what I found was, where I was being a clinical physicist and doing patient treatments, now all of a sudden I was asked to look at balance sheets. Now I was asked to go look at administrative stuff. So that transformation happened because of the knowledge I got, but the place I was not able to facilitate. Now, hey, this guy still has to do his day-to-day work, but he's got to grow into it. So what I'm going to say to you is that the benefit of having it is that it makes you a better world citizen, especially with what you're doing. And you can see decision making, not just from the root of the tree, but now you're at the top, or at the fruit, or at the highest point of it. So you get a better idea of how things work and how they connect. In terms of con, I wouldn't say there was a con, because in your leadership journey, or in your career transformation journey, the ROI, even though people say it's tied to time in a mathematical equation, it's also about the effort and what you do with your career, and how quickly you grow, how you network, and how you pivot with people, and how you immerse yourself into the experience. So I hope that answered your question. I hope that makes sense, coming from my angle, or my perspective.
One thing that I would add here, and I'm going to be just a little bit more direct in my advice, if you will, and you can take it or leave it, but I do not recommend sort of front loading all your education. So if you're doing your doctorate right now, go out in the field for a few years, and then make a, have that discussion and analysis with yourself, whether you want to do an MBA or not. Because I think right now, thinking about that is a little premature. I think you'll be better off if you go out into the field for a couple of years. I always make the recommendation of what I call my T model for growth and career progression. Get a lot of breadth, right? And then once you determine where your passion is, get the depth. When you get to that intersection, when you're ready to invest in the depth, that's when you can make a decision on whether it's an MBA or some other advanced degree that's going to help you in that regard.
Yeah, I agree. I mean, it made, I think the folks who generally went back for an MBA were trying to switch, right? They were trying to switch industries. They were trying to switch function, right? Going from sales to marketing, or, marketing to IT. Or they're just trying to switch location, right? They're like, I just want to move from the West to the Northeast. And an MBA is a really good opportunity to really just reset your whole career. So I'm with Mike. I wouldn't front load it. The folks who went into B school straight out of other schooling didn't have the same work experience to draw from. And so they didn't get as much value out of it, I don't think, personally.
And on that note, Samantha, too, the transition from like an individual contributor to a manager or in a leadership role. So you might find that, you have a lot of education and you seem really technical with what you do. You might really like that space, and you might not want to move up into like a leadership role. And that's perfectly fine. You can be incredibly successful doing that, and you can provide immense value to an organization and have a lot of fulfillment in that area. An MBA is really good for leadership. So if you want to look at, overseeing an organization, multiple organizations, overseeing people, making strategic decisions, that's where an MBA really comes into play. But if you're really happy with, focusing on research, it's probably not necessary, and it is a cost. So I would, see it through right now and see where you are and how you feel. And then if you decide you do want to move into that type of position, then pursue it. You're undoubtedly capable, PhD student. So.
Absolutely. Great advice. And again, too, still, you can even look into experiential, like, again, if your PI or others are flexible, maybe some experiences outside of academia can help you, really hone and make those decisions prior to jumping totally into something else. I did pop in beyondthephd.com. Take a look at that. There are many other platforms such as that can really help out, but great question. Okay, so Leo.
Good evening, ladies and gentlemen. My name is Salil Pai, and sorry my camera is not working right now because laptop's old. I'll fix it though. I'll have to fix it by next week. But anyway, so I'm a biomedical engineering major right now, so it's slightly different track, I reckon, than normal. So how exactly does somebody with a biomedical engineering degree venture into the whole business area? So, and like, is there any? I know there's necessarily no one way of doing it, but do you have any advice on how I would do that? Because especially they're going to look at me and they'll say, "So you took you took macroeconomics and microeconomics both in high school and here. That's about it. That's about the breadth of my econ experience." So any advice on how to look for careers in that area?
Internship to start.
Get an MBA, mic drop.
Yeah, like internship, and honestly, staying really open-minded and just talking to people. And there's never, people always say networking, and I know we've said it multiple times on this call. Networking isn't like being a creeper at a conference, right? It's connecting with other people and finding ways you can help them, right? Like even when you're brand new, like there is something you can do. There's some information, skill, talent, recommendation for like a restaurant that you have that's good, or you could, and lean on the alumni network, truly, like the Keenan Flagler Alumni Network. We all used it, and be like, hey, you know, I'm exploring different careers. You know, I'd love to learn more about your work, not through the lens of, and give me a job, so much as like, I'm just trying to learn. And then just see how it evolves from there. I know that's not necessarily super exciting advice. Like there's no one who can give you that answer. Maybe that's the better answer. No one can just answer that for you, except for maybe Rajen.
I did have a question for Salil. Salil, how far are you in your BME program?
I'm currently in my senior year.
Okay. What are you, let's just real quick unpack this. What is exciting about you in BME right now? Like what part of the biomedical engineering track is really exciting you?
So currently, I think my main thing is rehabilitation engineering. And so I was in one of the ideas that's floated around BME in many cases is doing startup work, or is just that, like, you know, having an engineering mind would theoretically be helpful in a business prospect. So I mean, like, I know that there's no such thing as an entry-level manager, but, you know, working in a business, I suppose.
Coming from a physics background, I mean, it's not engineering, but physics, I always found that going to companies or industry fairs where you actually interact with industries that hire biomedical engineers or people with your similar technical background, it's great to go to those, I guess you could say, vendor shows and actually interact with, you know, people that are in sales, marketing, or even the leadership in those, because that's that, hey, this is my trade, but there's companies that do my trade, and now I can interface with leadership or get involved in those companies and kind of, you know, as Samantha and all of us have said, network. When I did my physics background, we had, you know, when we get CMEs, I would interface with a lot of the companies that, you know, did patient products or did the accelerators where radiation was given. And funny enough, that's how I ended up working at Siemens, because somebody knew me and then they offered me a job.
Yeah, and I think if you're local in Chapel Hill, it's a great area with a lot of companies that do hire biomedical engineers. So I would really just attend, honestly, UNC networking events for that specific field. I mean, there's so many in this area, and I mean, Align Technology, we make and manufacture all of our products as well. So I mean, there's just a wide breadth of companies in that space in this area. So I think you'll be okay. You just need to start getting out there and exploring the different companies that exist in this region, but also have locations elsewhere, and just start seeing what's available.
And the only thing I will add, I think, is really if you think about where you are right now, you're a senior in college, I would kind of stick to what you're doing. Biomedical engineer, as Rachel mentioned, you're in a great RTP is just like a gold mine of you know, starting your career. There's going to be a lot of opportunities for you. If you get in with an organization like an IQVIA, if you get an organization with some of these other larger organizations that have multiple lines of business, there's going to be opportunities for you to learn about other parts of that business. And I think leveraging the resources you have with your employer are just as good as, and sometimes even better than any network that you have out there. So absolutely do the networking, but understand that where you want to go and what you're thinking about, and the way that I understand your question is this may be about 3 or 4 years down the road, right? It may not be something you're able to do right now. So focus on the biomedical engineering, get yourself in the door somewhere, and then pave yourself a path to where you want to go in terms of kind of combining the business side of things. And, you know, and you know, there may be other opportunities, who knows? Like I said, these large organizations, they have so many other facets that you may learn that, hey, there's this other thing over here that I'm interested that I want to do.
Absolutely wonderful advice. Again, to look at places that are going to help you grow and that are going to provide good mentorship. That's priceless. All right, Sophia, we're coming.
Sophia, R&D student
Sophia, we can't hear you.
Yeah,
We
we can't hear
can't
you,
hear you.
Sophia.
Yep.
I'm not sure. Can you hear me
Oh,
now?
Much better.
Now we
Yes.
can.
Much
There
better.
you go.
Oh. I think it might be my, let me try to disconnect my AirPod. I'm so sorry.
No, we can hear you.
We
We can hear you
now.
now. We can hear you now.
Perfect. Sorry.
Yeah.
Hi, I'm Sophia. I'm a PharmD student right now at UNC Chapel Hill, and I'm also hoping to pursue the dual degree program and get my MBA. And I'm kind of in the process of doing that right now since I'm a second year student. And I'm interested in digital health and entrepreneurship and healthcare consulting in this field. And I wanted to ask you guys about when we're doing interviews, because this is also internship kind of season right now, and making yourself stand out. We talked a lot about standing out and storytelling, but what are those key elements and characteristics or skill sets that when you're talking to someone, and they're telling you a story or telling you about themselves that are like, wow, that really resonated with me. Wow, that makes this person stand out over the other. Is it, I mean, having a personal story, yes, but connecting those elements to skill sets, and what is your advice on having a good story and that makes you stand out from a different candidate and kind of gives you that step ups? Is it kind of the elements of that make one story, or just someone trying to create a story? If you get what I'm saying.
Go for it, Mike.
Yeah, I just literally yesterday hired a intern from Gillings, the School of Public Health, and I use Gillings as well as Johns Hopkins and Harvard Public Health Schools as a pipeline for our internship. And a lot of our interns, when they're finished with their internship, if they're done with school, we have an opportunity open for them, we'll promote them to analyst. So the thing that I look for, honestly, is initiative and drive. And that is effectively, your technical skills, I think, are great, but I can teach you those, right? And those are easier to teach. I can't teach you initiative. I can't teach you drive. So those are the two things that are very important to me. And if you're able to demonstrate that, and you're able to not just demonstrate that in your resume, but in answering the questions that I ask you and how prepared you are for the interview, how responsive you are, those are sort of some of the cues that I pick up on, like, hey, this person, they have the intangibles, right? I can bring him in and I can basically train him to do anything I need him to do, because they have sort of the will to be able to just pick something up, and they have the initiative to learn as much as they can, sponge it up, and then be able to deliver on whatever it is that I need them to do.
Yeah, I would say asking good questions, right? Doing the research, reading their 10K or any information. Go to their investor relations section, pull up the last conference, last investor report that they did, flip through their PowerPoint, figure out like, oh, what are they focused on? What's important? Don't quiz the hiring manager on it, right? Like, they're not investor relations, but it does give you a flavor for what they're focused on, what the industry trends are. Get on LinkedIn, right? I know LinkedIn is like this old stuffy social media, but I love LinkedIn for keeping track of industry trends and just being able to ask, like, do they post on LinkedIn? What are they posting about? What is their CEO posting about? And kind of just immersing yourself in that space. And exactly like Mike said, being a sponge, and then asking good questions. So not just, there's so many bad questions. We've all been in those interviews, right? Something that shows that you've thought about the role and that you want to be there. And I think sometimes one of the ways to get your head in that space too is picture one of your classmates who does none of those things. What makes you different? Like, if you both got assigned the same task in the same course at the same time with the same professor, what are you doing differently that makes me want to hire you, right? Are you better at bringing people together? Are you better at doing deep research? It doesn't matter what your thing is. And don't try to necessarily cater to what the employer wants. Like, you're going to want to be somewhere that you're actually going to want to do the work. So if they need a super bubbly extrovert, don't be a super bubbly extrovert in the interview when you secretly hate people and you just want to hide in the couch, right? Like, it's a mutual exchange, and you're trying to figure out if it's a good fit for both sides. And so I think that helps settle some of the nerves too, is you're trying to figure out, yeah, is this going to be a good fit for me? And you are asking questions to try to figure out if it will be a good fit for you.
And I think it's really important to show that you've done your homework and you've done your research. So not only in having a lot of questions, and make sure you have more than you'll probably ask, because you might cover a lot of them in the interview, and then you're like, oh crap, I don't have any more questions because we already talked about everything. So have a long list. I would recommend using AI to prep for the interview. Tell them the company that you're interviewing with, tell them the position that you're interviewing for, ask them to tell you good interview questions to ask. Feed it the job description, ask it to create a list of interview questions that they might ask of you, both technical skills and soft skills. And then you can even ask it to provide generic answers and see if some of these align with your own skill set, how you would answer it. Make sure you're prepared and use technology to your advantage. Use it to help you with your resume, with a cover letter. Make sure you don't sound stuffy, make sure you review what the AI produces, but use it to your advantage. And I would definitely say, look at the company's website. If they have a mission statement that really resonates with you, say that. If they, contribute to a charity that you really admire, or you have a personal connection with, say that. People like to know that you actually care and you've done your homework, and just through that demonstrate that you're a hard worker, you're a fast learner. And I think that's what anyone's looking for when they hire out of college.
Yeah.
I want to add to that. If you're going to tell a story, please be authentic. Please be authentic, and make sure that the story that you tell is not fake. It resonates with you and personal experience, because I'm pretty sure all of us have had people that make up a story and then they get caught into this really bad lie. So I've experienced that. So authentic storytelling, if you're going to tell a story, tell of an experience where it actually is a transformative journey, so I can see some of the soft skills you have. Like Mike says, technical skills can be taught by the employer. That's why you're applying for the role, and also being an integrated part of that company. But authentic storytelling, be genuine, and if it resonates personally with you, it will come across.
And
That's
if
really
you know
good.
anyone in your network that works at that company, ask if they'll do a referral. Most people get money for referrals that get hired, so they're incentivized. So don't be afraid to reach out to someone if you know them on LinkedIn.
Thank you. That was all very helpful.
Mhm.
Terrific. And Kayla.
Hi, good evening. My name is Kayla. I'm not necessarily looking to get advice on how to transition into a role in business or trying to get into business school of sorts. I'm actually in my second year of a DNP program with the nursing school at Carolina for a doctorate and just to be a nurse practitioner. So I have a little bit of maybe almost 6.5 years of experience as an RN. And I specifically joined onto the Zoom because I was interested in the whole AI / like digital health innovations and like what that means for us as providers. And so my question was like specifically what type of training or like resources do you guys believe as people who are in the field, do you believe are kind of like essential for providers from a primary care standpoint to effectively like integrate AI and digital health innovations into their practice from a systems improvement standpoint, health equity especially, and then also just I guess to kind of further the point of improving positive patient outcomes. And I'm saying like health equity and systems improvement. And I'll just give you an example. Like the first thing that came to my mind was like MyChart. And I know it's been around for some time, like since like 2000 or whatever, but I'm just thinking like from a patient's perspective, as a patient myself, I mean, when you get like results from MyChart, it automatically comes to the patient, and sometimes the providers don't even get a chance to see it. And I'm just thinking to myself from a health equity standpoint, like what does that mean for someone who's not health literate? What does that mean for someone who it may exacerbate, symptoms or, precipitate a somatic disease process or something of the sorts, like in terms of anxiety or depression before their provider can even get to them? Like, what does all this mean, and how can we train not only the providers but systems from a systems perspective, how to integrate it effectively without, I guess, decreasing patient improvement, if that makes sense. And it was a mouthful, but that's what I
Kind of
was.
a multi-million-dollar question is what I would say.
Yeah, I would just offer, because we only have 5 minutes, Kayla, just hit me up on LinkedIn. Let's get some one-on-one, because I deal with this quite a bit in my consulting practice. So I'm happy to have a more extensive chat with you about that, because it is a great question, but it's a very, very broad topic.
Okay.
Yep, and actually we have a
Maybe.
recording. If you go on to our YouTube channel, just email me. Actually, Mike was on the fireside chat, but it was all about use cases for AI in healthcare. So you can watch it, and it was really fantastic, and it really talked about exactly the question you asked.
Okay. Cool.
And
Thank you.
Kayla, feel free to similarly hit me up on LinkedIn, because that's part of what my company does, is kind of clinical decision support tools.
Yeah, likewise, I use my chart and do AI stuff in oncology. So yeah, I would love to give some feedback.
Okay. Cool.
Yeah, and I've had experience with the chart coding process at hospital networks, and I know it is a nightmare, and I'm sure there's a lot that AI could do to improve upon it. So feel free to hit me up on LinkedIn, anyone here on this call, if you have any questions.
Absolutely. And again, great question. And again, we just don't have enough time. It's a deep question. So thank you so much for a very thoughtful question. We only have a few minutes left. So this is a time where I'm just going to ask our panel if each one of you all can just come up with one trend that you feel either in your industry or even maybe your company will be afoot in the near future.
I'll speak on, if everyone's okay, on the I guess you could say the big problems I'm facing as the trends of cancer incidence has been increasing. We have found it extremely hard, especially even in the clinical space, to provide equitable patient care to people in rural areas and even in areas where I'm finding people not entering the industry, just because post-COVID, I have a hard time finding people that are physicists like myself, or people that are getting into the industry. It's become very hard because a lot of people know now regulations have changed for schooling, and licensing has changed too. So what used to take someone like myself 6 years is now taking 12 years to get into the field. So the horizon of people that I'm trying to get, I'm looking into treating people today for the future, for people that are not out in school yet or even ready. So finding a way to bridge things like AI, reducing burnout, and finding other solutions to be able to still provide equitable patient care at high quality, but also do it with the current workforce that I have, has been half the challenge. So I think that's going to be a trend we'll face, because there's a new health statistics that in the next 5 years, 30% of the workforce in healthcare is going to retire because they're baby boomers, older physicians and providers. So now I got to figure out how in the next 5 years I'm going to find these people to provide equitable care. So I see workforce and AI and technical operations coming into some nexus point, at least for what I'm doing.
Thanks. And everybody else, you got a minute.
Sorry.
I would say just familiarize yourself with technology. You guys are all young, you grew up with technology. There's probably nothing you can't learn and tackle by yourself. So those jobs that you're interviewing for, kind of fake it till you make it. You're going to be a quick learner with any kind of system or application that they say you need experience in. Watch YouTube, learn it, get familiar with it, do free trials. Having those skill sets so you can add to your resume on the different applications that are used widely are going to be huge. I'm a quick learner with those. I've taught myself how to do data analytics and Power BI, AI. Use all the free resources you can and add those to your resume. And I'm confident that you'll be able to master them once you get your foot in the door.
I love it.
Mike and Samantha?
I don't feel like I have anything terribly insightful. I think AI is my favorite term I've heard for it is it's a jagged frontier. There are things that it's very good at, and there are things that you would expect it to be good at that it's not good at. And so I think the more you can explore and map that jagged frontier, the more knowledgeable you will be in those conversations, and you can be yourself. Influencer is not the right word, but just showing that you're knowledgeable and that you're hungry, because that's something every employer wants.
Terrific. And Mike, round us out for the evening.
Yeah, everyone's beaten up on AI, so I'll go somewhere else with this. One of the things in technology that we're seeing is a lot of the focus on self-care as well as what I would call population or patient administered medicine, right? And that's basically enabling individuals to care for themselves, right? Whether that's doing their own diagnostic labs, caring for chronic conditions, remote patient monitoring. Those are trends that are just nobody's really talking about, but there's a lot of investment in that area in healthcare right now. So that's something else to just be in the back of your mind, because it's going to change how healthcare is being delivered in the future.
Mm-hmm.
Terrific. And again, we're just about a minute over time, but thank you for sticking with us. And again, thank you so much for our panelists for taking the time out tonight after, I'm sure, busy days at work. And thank you to our audience for attending and asking such wonderful questions. So again, I hope everybody has a wonderful night, and I hope everybody can show up for our next panel. Again, you can catch that on our CBOH website under events. So again, thank you so much, and we'll see you next time.
Bye, everyone.
Thank you, everybody.
Thank you.
Thank you.